Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today I'm going to be answering one of the questions that I got this week from one of the doctors I connected with. He asked me to write something, so I wrote a blog about handling non-compliance in orthodontic patients. Like, what do you do? And inadvertently, the benefit of using removables, like expanders, Schwartz's, different functional appliances, aligners, is that it's healthy. Nothing can really go wrong, but they do have to wear them, right? Same thing, even if you're going to be doing braces, which is fixed, at some point you're probably going to have elastics in many patients to get a good outcome. So you're still going to have compliance. So compliance is going to come pretty much no matter what system you use. So it's something you want to kind of understand. And for me up front, I like to establish expectations with both the parents and the patients. It's a great idea if you create a compliance contract. I have some templates in my store on my website, but it might be something you want to custom make because I've seen some they look a little bit harsh. But mostly just saying, hey, this is how this is going to work. This appliance, in order for this to work, we all have to collaborate. Little Joey has to wear it 22 hours a day. Here's how we're going to do it. Take them through the day. What's going to happen at lunchtime? What can you do as the doctor to make this easier on the family? Because it brings stress into the family, right? So usually the biggest hurdles are, lunchtime, which you may not even be having this issue. If most kids are studying at home this year, this is like perfect time to be doing, removables. But, for me, sometimes it meant I'd buy the kid a retainer case on a string that she wears around her neck, or they can clip to their lunchbox, or just trying to find what that push point is, to help them get through the day. So, or same thing, what do we do when they're supposed to be playing sports, or instruments? Like, let's make sure that the appliance gets taken out of the mouth and gets put away and then goes back in the mouth. But yeah, establish expectations, help to walk the parents through the day, help them kind of tackle their concerns that they might have throughout the day. Both the kids and the parents probably have some concerns, but ultimately, in general, I like to have some type of 3 strikes rule where maybe not every, I like to assume kids are awesome kids, but sometimes there's ones that just aren't compliant, and usually they're having issues at home too and at school, and it's not only it doesn't manifest itself only as a behavioral thing, with the ortho. It's everywhere. So, the parents do appreciate your help with that. But I like to say there's a 3 strikes rule where after 1 or 2, 3 times that, you're not compliant, then we have to really think about stopping the treatment and doing something else, which might mean, let's say you had elastics, for example. Let's say you had a class 2 case, you're a couple millimeters class 2, you needed to correct it with elastics. It would probably take 4 months. Patient's just not wearing it. Or they're only wearing it a few hours a day, which is basically not going to do anything. You let them know the first time, you let them know the second time, the third time you say, okay, well, we have 2 choices here. We've given our 3 strikes, so we can either do some interproximal reduction, which means, grinding on your teeth, which, are extractions. We don't really want to do that, but that's an option. Or we can just discontinue treatment. You can leave, teeth are straight, your bite's a little off, but, when you're older, you can always go back and get into some type of aligners or braces if that bothers you later. And a lot of times families are fine with that. It takes the stress off of them. Some other parents are going to ask you maybe to do something fixed. There are some fixed appliances like Carrier's or Force's and stuff. For the most part, every time I've done those, it's been like terrible. The patient was pissed off. The parents were pissed off even though they asked for it, because it just disrupts life a lot in terms of how you eat, discomfort, breakage. These type of kids that are getting it, they're being forced to get it. They're very angry. I've done some, and I don't think I would do it again. I mostly just stick with removables, and if the kids can't be compliant, then we got to do what we got to do. So I don't believe in medieval torture devices to try to get a bite. But anyways, so that's the elastics thing. But there are some ones you can do for distalization that, like a Carrier and stuff, that are not that bad, So definitely an option. And then the other option would be for something like an expander. If they had a removable expander and then they wanted a fixed expander instead, or they had aligners and they wanted braces instead, then the parents pay an upgrade fee, and the upgrade fee should be equivalent to the lab fee plus the measurement and the delivery fee. So your chair time, everything. So you'd be charging easily between $500 and $800 for this change in treatment plan. parents need to pay for it, if that's what they're deciding to change, because they weren't compliant. And also there's additional time in treatment. So, that's pretty much how it works. But the main thing is just these type of things tend to be the ones where you get your most complaints if you don't manage it right. So you really just have to be direct with the parent, giving them options. Sometimes it might mean you might need to give some money back, okay, because we're finishing treatment early. That's the right thing to do. They're going to be less likely to complain, not the whole thing. But, again, on the front end, explaining to parents, even when you get started, hey, here's how this is going to work, okay? The first visit has about this much of a value because this is what we do. The second visit has the most value. This is what we do. The other visits are a little bit less. So if you decide to discontinue here at this month, then, you might get 20% back or something like that. And usually parents are pretty cool about that. So yeah, that's it, handling non-compliance. But also the main thing is that especially if you're a GP or a pediatric dentist and you're doing ortho, you can partner with the right parents and kids that you want to. If this kid's wiggling around in the chair and jumping around or having behavioral issues, it's not somebody you're going to want to partner with. Partner with the kids that are well behaved, and the other ones to the specialists. As orthodontists, we have to take everybody pretty much. If they're really bad, we send them to the university. That's our other one. But anyways, all right. Thank you so much for listening.